This video consent is presented today to discuss the procedure called brow lift. Aging typically causes your brows to move downward. Additionally, as skin and soft tissue lose elasticity, the distance between your eyebrows and eyelashes shortens. A brow lift, also known as a forehead lift or forehead rejuvenation, is a procedure aimed to address some of these issues. It is used to improve the appearance of the forehead, the brow, and the area around the eyes by raising the soft tissue and skin of the forehead and brow. A brow lift is often undergone to address the following: furrows or frown lines, such as those caused by stress or muscle activity occurring over time, sagging in the brow, brow asymmetry. It can also help correct inherited conditions, such as a low, heavy brow or furrowed lines above the nose. Important factors to discuss with your surgeon prior to undergoing a brow lift include the most appropriate type of brow lift surgery for your situation, age and skin type, ethnic background, degree of skin elasticity, if you are currently using Botox injections, individual healing rate, realistic expectations for surgical outcomes, whether the brow lift will be done with other facial procedures such as eyelid surgery or a facelift. If undertaken, the goal of a brow lift is to modify drooping brows to rejuvenate the eyes, making them look more rested and youthful. You will still be able to wrinkle your forehead after a brow lift unless you are also using Botox. In addition, a brow lift might also boost self-confidence. Brow lift surgery is an outpatient procedure performed using general anesthesia. The technique used by your surgeon depends on your expectations, unique anatomy, and the extent of correction needed to achieve your desired results. The three potential options include classic or coronal brow lift. In this option, after anesthesia has been administered, your surgeon will make one continuous incision from ear to ear across the top of your head. In some cases, your surgeon may place the incision at your hairline. Excess skin, fat, and tissue are removed, and the remaining skin and brow muscles are repositioned into a more youthful appearance. Endoscopic lift. This is a minimally invasive procedure where your surgeon makes several small incisions behind your hairline. Then, a thin tube attached to a lighted camera, called an endoscope, is inserted into one of the incisions in order to view the tissues and muscles from a screen. Using an instrument inserted through another incision, your surgeon will reposition the muscles and lift underlying tissues of the forehead, removing excess fat and tissue as needed to create a naturally more youthful brow. Because the incisions are smaller, this procedure is less invasive. You will experience minimal scarring and shorter recovery time. Temporal lift or limited incision. A temporal brow lift involves slightly longer incisions than an endoscopic brow lift and is most commonly performed in conjunction with eyelid surgery. Incisions about 1 inch long are made just above each temple, behind the hairline. Through these incisions, your surgeon will lift and reposition the tissues of the outer brow area. In each of the above techniques, your incisions may be closed with sutures, staples, clips, or skin adhesives, which are typically removed about 1 week after surgery. The duration of your surgery depends on the type of brow lift you are getting and whether or not another procedure is being performed at the same time. As in any operative procedure, a number of complications can occur. It is important you be informed of these potential complications. Complications related to anesthesia may occur and should be discussed with an anesthesia provider. Other complications may include, but are not limited to, infection, bleeding, scarring, fluid accumulation, changes in skin sensation, asymmetry in the position of the brows, eye irritation or dryness, weakness of the brow movement, numbness of the scalp or forehead, intense scalp itch, hair problems such as alopecia, change in location of the hairline, dissatisfaction, need for revisional surgery, prolonged hospitalization. Although most procedures have good results, you understand that no guarantee has been made to you about the results of this procedure or the occurrence of any risks, complications, and side effects. You recognize that during the course of treatment, unforeseeable conditions may require additional treatment or procedures. You request and authorize your doctor and other qualified medical personnel to perform such treatment or procedures as required. You may have other risks that are unique to you. Be sure to discuss any concerns you may have in addition to those listed. You can choose not to go forward with a brow lift. If that is your choice, you have other reasonable alternatives to consider, including doing nothing, Botox injections, dermal fillers, non-invasive skin tightening with radiofrequency or ultrasound. These alternative forms of treatment have their own potential risks, benefits, and possible complications. Your cooperation with your post-surgical recovery is critical to a successful outcome. You can reduce the risk of certain complications by following your prescribed treatment plan. Prior to the procedure, tell your doctor if you are sensitive to or allergic to any medicines, latex, tape, and anesthesia medicines. Tell your doctor about all the medicines you take. This includes both over-the-counter and prescription medicines. It also includes vitamins, herbs, and other supplements. You may need to stop taking these medicines prior to your procedure. Tell your doctor if you have a history of bleeding disorders, or if you are taking any blood-thinning medicines, aspirin, ibuprofen, or other medicines that affect blood clotting. You may need to stop taking these medicines prior to your procedure. Tell your doctor if you are pregnant or think you may be pregnant. Stop smoking as soon as possible. You should also limit your alcohol consumption. To determine your treatment options, your surgeon will examine and measure different parts of your face with your eyes opened and closed. Photographs will be taken of your face from different angles and placed in your medical record. These photos will be used for before and after assessments, reference during surgery, and long-term reviews. Most importantly, the photos permit a specific discussion about the goals of surgery. Your surgeon will also take a thorough medical history as well as assess your mental and emotional attitudes toward the surgery. You will discuss outcomes and expectations with your surgeon prior to the procedure. You may be given medicine to help you relax before the surgery. Because the sedative will make you drowsy, someone must drive you home. After the procedure, you will go into a recovery area to be monitored after surgery and will be released to go home once your pain is controlled, you are off of oxygen, and you are tolerating liquids by mouth. Your forehead will be loosely wrapped to minimize swelling, and a small tube might be placed along the incision site to drain any excess blood or fluid, depending on the process used. Your doctor will give you specific instructions on how to care for your incisions and indicate when sutures or staples will be removed. Your doctor may prescribe pain medication, though pain with this procedure is usually minimal. Headache is very common. You will probably have some swelling and bruising, which can affect other parts of your face, including your cheeks and eyes, which is normal. You may also experience numbness or tingling, which should go away over time. The swelling should decrease within the first few weeks, but it may take several weeks for all of the swelling to go away. Applying cold compresses can help reduce the swelling. You should keep your head elevated to lessen the swelling for the first few days following your procedure. This includes when you sleep. Most patients can return to work or school within a week, some sooner, depending on which procedure is used. You should avoid heavy lifting, vigorous exercise, or other activity for the first few weeks after surgery. Driving is typically allowed once you are off the narcotics and feel that you could react in the case of an emergency, usually a couple days up to a week after surgery. Scars are usually not noticeable. However, if you do have scarring, makeup can minimize the appearance until total healing has occurred. The aging process continues after surgery, and some relaxation of tissues will occur during the first few weeks. It may take 6 months to see the final result of the surgery. A brow lift is semi-permanent in that your skin will relax over time as you continue to age. Initial swelling may obscure wrinkles post-operatively, but these will return once swelling goes down, or if you continue Botox treatment. After a brow lift, contact your doctor immediately if you have signs of infection, sudden rapid increase in swelling, fever, shortness of breath, chest pain, irregular heartbeats. You agree that everything has been explained in terms you understand, and all of your questions and concerns were asked and answered. You understand that a successful outcome is sought but cannot be guaranteed. You are satisfied with the explanations and desire to have the brow lift perform knowing the risks. Thank you.